Auscultation of heart sounds is an important skill that leads directly to several clinical diagnoses. Before auscultating the heart, let's review normal heart sounds. Closure of the heart valves creates a pair of audible heart sounds. The first sound, S1, arises from closure of the mitral valve. Tricuspid valve closure may also contribute to S1. The second sound, S2, arises from closure of the aortic valve. Pulmonic valve closure may also contribute to S2. Ventricular systole occurs between S1 and S2. Ventricular diastole occurs between S2 and the next S1. The fact that diastole usually lasts longer than systole is helpful in distinguishing the two sounds. The abnormal sounds of S3 and S4 can be heard in early and late diastole.